The first thing that we're gonna do is give a postural exercise for a patient that has forward or rounded shoulders, and I'm gonna choose to do a scapular retraction exercise because with a forward and rounded posture, those scapular retractors are gonna be weak and lengthened, so we're gonna give exercises to facilitate that strengthening. And the first thing that I'm gonna do is teach him what that motion should feel like. I'm going to palpate for his inferior angle and put my fingers here, and I'm gonna ask him to put his shoulders back and down like he's gonna put his shoulders in his back pockets, and I'm gonna resist it. All right, ready? Go. And relax. So now that he knows what that's supposed to feel like, we're actually gonna give that exercise. So I'm gonna ask him to go ahead and lay on this towel. We're gonna ask him to put his forehead flat on the floor, and we're gonna have his arms out to 90 degrees on each side. And then I'm gonna ask him to point his thumbs upward, and we're gonna do T raises. So you're gonna point your thumbs towards the ceiling and lift up with that same motion. Go. And down. Perfect. There, we were gonna have him do it for 3 sets of 15 reps. We wanna make sure that we're assessing his response to it. Did you have pain with that exercise?
No.
And do you feel like your back feels a little bit better afterwards?
My back feels better.
All right, then we'll continue the exercise with him. So the second thing we're gonna do is give an intervention and a muscle energy technique to treat general sacroiliac joint hypomobility. And I'm gonna choose to do this shotgun energy technique because this directly targets that sacroiliac joint hypomobility. Come on the outside of her legs and do the best that we can with body mechanics because we're on a couch that doesn't raise. Grasp kind of on the outside of her knees here, and I'm gonna ask her to pull her knees apart and don't let me move you. Ready? Go. Hold for about 3 to 5 seconds. And I'm gonna get on the other side and I'm gonna come on the inside of her knees here, and I'm gonna ask her pull her knees together and don't let me move her. All right, ready? Don't let me move you. And hold for about 3 to 5 seconds. Relax. And we're gonna hold those for about 3 to 5 seconds, alternating, and we're gonna do them about 5 times. And we also wanna make sure that we're assessing the patient's response. We wanna make sure that she didn't have pain with the exercise.
No pain.
And we wanna make sure that she's feeling like it's working and that she has more mobility after the fact. So the next intervention that we're going to do is a central posterior to anterior mobilization. So I'm going to come over to my patient here who came in with pain today, and she is having pain with movement, and it hurts when she does that. So before we do these CPA mobilizations, I would make sure that she didn't have any vertebral artery occlusion, that she didn't have any dizziness, and that she was clear for all contraindications and precautions for the cervical spine. So I am going to tell her that she needs to communicate with me throughout this entire process, and that a little bit of pressure felt during the spring test and the actual mobilization is okay, but any signs comparable to the signs that she came in with, any numbness or tingling or extreme pain, she needs to tell me so we can stop it immediately. So I have her lying prone here, and I'm going to perform a spring test over each of those cervical vertebral segments. I'm going to be utilizing a power grip with my thumbs supporting each other, not hyperextended, with the spinous process in between. So the first thing I'm gonna do is palpate her occiput here, and I feel it right there, and come down to find that C2, get my power grip going, and have that C2 spinous process in between, make sure my thumbs aren't hyperextended, and I want you to communicate with me during each spring test, okay? Okay. So I'm gonna give you gentle pressure, and you're gonna tell me where it hurts. Does that hurt?
No.
How are you feeling?
Good.
And there?
That one is uncomfortable.
That one, that's the one that hurts?
Yeah.
All right, so that was C2, 3, C4 right there. So we're gonna go ahead and keep that, and I'm gonna perform gentle oscillations for 6 to 8 seconds over her C4 vertebrae. And she can go ahead and sit back up. And how are you feeling?
I'm feeling good.
Any lightheaded or dizziness?
No.
All right, so we are going to go ahead and have her perform that flexion one more time. And how are you feeling?
It feels better.
So it worked. So the actual dosing for this is gonna be to have her perform the movement that hurts, oscillate for 6 to 8 seconds, and then retest that movement to make sure that the pain is decreased or eliminated. So the next technique is a self-stretch for the erector spinae of the lumbar spine, and I'm going to choose to do the knee to chest stretch because I think that this is a simple exercise that the patient can do on their own, and it's safe. So I'm going to start by having the patient in a hook-lying position, and I'm going to ask that he grasp around one of his thighs and pull the knee into the chest, and we're going to hold that for about 3 to 5 seconds, and then put the leg back on the ground. I'm going to ask that he repeat the same gesture on the opposite knee, and then putting it back down after 3 to 5 seconds. Then he's gonna grasp both knees and bring the knees together and pull those knees into his chest and lifting the sacrum off of the mat. And then relax. So the dosing for this is gonna be to hold each leg about 3 to 5 seconds and then hold both legs for about 3 to 5 seconds, and we're gonna do that 10 times. Then I'm gonna assess to make sure that the patient is okay. So did you have any pain with that?
I didn't have pain.
And did you feel like it was stretching your back where you wanted it to?
Yes, it was stretching.
So we're gonna keep that in his program. The next intervention that we're gonna do is a low-level strengthening exercise of the multifidus. I'm going to choose to do just a multifidus activation because it is low-level strengthening, and I'm gonna teach the patient how to activate it so he can implement it into his daily activities. And I'm gonna have him prone and with his arms by his sides. I'm first gonna palpate the spinous process and come off laterally on each side, work my fingers down between the erector spinae, and I'm gonna ask him to swell the muscles of his back. There's the contraction, and I'm gonna ask him to hold that for about 15 seconds. And he's gonna let that go and then repeat that 3 different times. So since he's contracting the muscle and learning how to do that, that low-level strengthening exercise of simply the muscle contraction will help to stabilize his spine, and that way he can implement it into his daily activity. Or we could also combine it with the transversus abdominis activation as well. So did you have pain with that?
I didn't have pain.
Over time, the spine will stabilize and the muscles will make him stronger. So the next intervention we're going to do is a high-level strengthening exercise for the transversus abdominis, and I'm choosing to do a quadruped transversus abdominis activation with extremity involvement, and it is high level because it's in quadruped and it does involve using the extremities. We're supposed to use a yoga block, but we don't have one, so we're going to use the O'Sullivan textbook, and I'm going to have her go ahead and get on her hands and knees and put her left knee on the book and get kind of close to the wall there, but we're not actually going to touch the wall. It's just going to be like a reference point for her. To ask her to lift her right knee off of the ground and maintain a neutral spine, and imagine that she has a rod going down her spine that she's not going to let fall off. And ask her to go ahead and draw her belly button towards her back to activate the transversus abdominis. I'm going to ask her to extend her left arm and then extend her right leg for the extremity involvement while keeping that belly button towards her back, and then back down. And one more time. And then back down. So this dosing is going to be about 3 sets of 12 reps. I'm going to go ahead and assess. So did that movement cause you any kind of pain or discomfort?
No.
And do you feel like it challenged you?
Yes.
Okay. Then she was good, and we would go ahead and keep this as a part of her exercise program. Another thing that we could do to make it an even higher level strengthening exercise for the transversus abdominis would be to add perturbation, or you could even add ankle weights, which I don't have access to right now.